Stephen Masley, so glad to have you on Homekeepers.
Delighted to be with you.
My Homekeepers viewers are well familiar with Deborah Ray, friend of yours, and she gave me this book that you've written, The Better Brain Solution. We want to talk about that, but I'd like to talk first a little bit about your background. When you were a little boy, did you always want to be a doctor?
You know, when I was a little boy, my dad was a surgeon, and he was gone at the hospital. So if I wanted to see him, before I could drive a car, I would pedal my bike to the hospital. And, you know, back in the 1960s, if your dad was like the head surgeon at the hospital, I would just put on scrubs, check in with the head nurse, scrub up,
No kidding.
and walk right into surgery. Now, today, fortunately, that would be illegal. But then, in the 1960s, that's just how I talked to my dad.
Well, that was kind of on-the-job training, I guess. Do you do surgery?
No. I mean, my dad, I probably would have loved if I'd been a surgeon, but I wanted to be. So I grew up as a kid thinking my people loved my dad. You know, they felt he saved their lives over and over. But I thought as a child, people went to the hospital and they were tortured. I grew up wanting to be a doctor that kept people out of the hospital. And I think that's what I've become.
You're my kind of doctor. I just read recently all the mistakes that can go on in a hospital. So I'd say if you can't stay out, it's probably a good idea.
It's pretty scary now.
Yes. Now, give me a list of I've written it down, but I'd rather hear it from you, of not only degrees, but fellowships and things that really is quite impressive all you're involved in medicine.
Well, I've been involved in research since the early 1990s. I've done one of the first physicians in the country to do group visits, and I've published over 20 trials and clinical trials. So I've had the experience and the opportunity to really make a difference. And I got awarded a fellow from the American Heart Association, the American College of Nutrition, and the American Academy of Family Physicians. I'm really proud of those, and those represent, you know, research and looking at how can lifestyle improve our health.
And I certainly congratulate you on those, perhaps a bit late. Now, you've written a book on the heart.
Yes.
And what's the name of that? They might want to know that.
The 30-day heart tune-up.
Okay, 30-day heart tune-up. I like that title. We're talking about the Better Brain Solution, and it really grabbed me to think that maybe finally, after many centuries, decades, that they're really studying the brain and to see what affects it and what can improve it and what won't and what we're doing wrong with it. What was it that piqued your interest to write a book on the brain?
Well, in my clinic, we measure how people age. We measure, are they growing plaque or not in their arteries? We also measure brain processing speed and memory. We do computerized tests to look at how does your brain function. And we realized that, you know, having measured brain function in over 1,000 patients, but we also looked at what they eat, their nutrient intake, their fitness, how they manage stress, and do they have toxins that they're exposed to. And those 5 factors have a big impact on the brain. So we've published studies showing that if you make the right choices, you can actually improve your brain function, increase your brain processing speed by over 25%.
Most of it doesn't cost much either. I mean, we're not talking about expensive pills.
No, we're talking about right choices that we make every day.
Yes. We're going to put your website up on the screen, and I noticed as I looked at you even have recipes in there. I
do. I have a recipe of the week on Saturdays we send out for people.
Okay. Occasionally, sluggishness is different than continuing gradual decline. And you say, fortunately, they can be delayed or prevented. So are we going to just feel sluggish once in a while just because we're on this earth and we're trying to function, but it's not a long-range problem?
Well, yes. If we make not the right choices, we don't get a good night's sleep, we skip our exercise. I think that all of those makes us a little more sluggish. We feel a little brain fog. And if you do those things every day, then that becomes kind of scary because, I mean, Alzheimer's disease is the most expensive disease in the U.S. today. We spend more on memory loss than we spend on heart disease or on cancer. And it's going to double in the next 12 years. The rate is increasing rapidly. So it's a huge problem. But the good news is we can prevent most of it. We can really make a huge difference and improve people's brain function so they feel sharper, quicker, and more productive.
That's what we like on this program, you know, some good news. Now, you talk a lot about blood sugar, and there are 2 diabetics in my family, and I'm somewhat familiar with it, but as the more I read your book, I thought, I don't know what I should know. Is there a normal blood sugar? Because with a diabetic, it can go too low or it can go too high. Is that true if you're not a diabetic?
Well, your blood sugar shouldn't be high. I mean, I look at, the standard cutoff is 100, but even 95, below 95 is clearly better than a level of 100, which is where the beginning of pre-diabetes. By the time you get to 110, which some doctors would say, oh, you're fine, but you're actually injuring your brain when your blood sugars are even mildly elevated. So the number 1 cause for accelerated memory loss is sugar in our food and sugar in our bloodstream. And the number 1 cause for heart disease is the same. It's too much sugar, too many refined carbs, processed food, sugar in our food, and it's killing us.
That's what is so interesting, that the same thing that can bother or help your brain does the same thing for your heart, for the most part.
They're intimately connected. There's all these, when we looked in our clinic at what predicts memory loss, the strongest predictor was really artery plaque growth. If you're growing plaque in your arteries, your brain is shrinking at the same time. And here's the good news, though. We have hundreds of people who've shrunk their artery plaque and improved their brain function at the same time.
Now, how do you, I would assume you need a physician to determine artery plaque, but what about blood sugar? My son has a thing that measures it that's not even connected to him. It's amazing. It's in the car when he drives or wherever he goes. He can lay it on his desk and it'll tell him.
Yeah, there's sensors now to measure blood sugar.
What about normal people like myself? How would I measure blood sugar?
Usually if you go to your doctor once or twice a year and they ever do blood work, I mean, that's one of the more common things we measure is a fasting blood sugar level.
But just your average person, they don't need to carry around some kind of a device to measure it?
No, but you should make sure the first sign your sugar level's going up can be brain fog. Things like you forget why you walked into a room, you forget names, have trouble finding your car after you parked it, you have to reread a passage in a book. Those are all signs of brain fog. And then the second one is an expanding waistline. If your waistline is expanding, that's a really worrisome sign that your blood sugar is going up.
I believe that maybe it was First Lady Michelle Obama who really put a spotlight on childhood obesity, which I thought was great. You mentioned in your book how I believe both Alzheimer's and obesity can bring our health system down.
Well, it's increasing. I mean, think about it. The most expensive disease today, $215 billion a year, is projected to double in the next 12 to 15 years. I mean, we're talking over $400 billion a year just for Alzheimer's. We can't afford that. But again, we can prevent it by giving people the right food, the right nutrients, activity, stress management, avoiding toxins, an easy 5-step program to protect your brain. We can stop what, is almost going to be a plague upon us unless we do something to prevent it.
I just noticed, just living my life, I notice in the stores, if I'm going to buy clothes, that there are more and more bigger sizes.
Yes.
I wear, I'm sure you want to know this, a 6 or an 8 size jean, depends on, and I was in the store the other day and they started at size 10 and go way up, and the plus sizes are getting bigger. Also, when you go in a big grocery store, there's more people, riding around the store instead of walking. And this is just what we observe in everyday life. The statistics might really scare us.
Well, more than a third of people are obese. More than a third are overweight. And of the third who are normal weight, at least a third are normal weight because they're sick. They have like cancer. So, I mean, it's really a small percentage of people today that are at a normal weight. And the biggest problem is the sad standard American diet. We're eating the wrong food. We need to change what we eat, and that could totally transform our health for the better.
Okay, now some of the myths of Alzheimer's, or is there a difference in dementia and Alzheimer's?
Dementia is a broader term. Dementia basically means you are disabled from memory loss. Alzheimer's is a specific type. So there's several types. You could have multiple strokes. Well, that would be a vascular form of dementia. Or your brain could be gradually shrinking and you're forming beta amyloid in these tau proteins. That's Alzheimer's. That's 70%, approximately 70% of dementia cases out there today.
Is it true that Alzheimer's is not absolutely diagnosed until death, when they can really look at the brain?
Well, technically, it's a biopsy. So you have to have a brain, you have to see the beta amyloid protein and these tau fibrils. So I think you're correct. Mm-hmm. But we're able to, basically diagnose it by the history, gradual memory loss. We do an MRI, we see gradual brain shrinkage. You can even now, collect body fluid and look at beta amyloid levels. So,
and what is a beta amyloid? That's a brand new word for me.
Beta amyloid, that's the protein we form that's sticky and inflammatory, that is a sign of Alzheimer's disease. It may not be the cause. It could be like if there's an infection in the brain, you make beta amyloid to protect it, but that beta amyloid is an inflammatory sticky.
Good.
It's a sign. It's a sign of a shrinking brain.
My mom lived to be 100, and she's pretty sharp till the last 7 or 8 years, as there was that decline. But I had read a couple books on Alzheimer's, and I never thought she had it, according to all those stats. That her, she just kept deteriorating, because it seemed like there were specific things that went along with Alzheimer's that I never saw with her, but never dreamed there was anything you could do to stop it or reverse it. And so that's why I'm glad.
Well, now we know there is, and now we know there's hope to really make a difference. 5 easy steps to transform your life, improve your brain function, and prevent memory loss.
Yes, and if you just joined me, I'm talking to Dr. Stephen Masley, and I'd like to have 3 hours to talk to him. He wrote The Better Brain Solution. There's information on the screen right now as to how you could get it. And let me tell you, I could understand it. It is well written in layman's terms, and well documented, has a lot of recipes that are good for the brain. And so I'm delighted to bring you to my Homekeepers viewers. Okay, I'm going to read this. Here's some myths about dementia, or just brain deterioration maybe. It only comes to old people. Memory loss is a normal part of aging. Is that absolutely wrong?
It's not a normal part of it. We shouldn't lose our memory. We should stay sharp and alert.
And I've met people like that were up in their 90s and they were sharper than I am.
But we have to make the right choices for that to happen.
Memory loss caused by vaccines and flu shots.
No, that's not. There's no evidence that you get memory loss from vaccines.
Okay. Aluminum. We've always heard that. If you cook in aluminum.
Not really true. Yeah, I'm not recommending people go out and ingest aluminum, but that data just never panned out. So no, we don't think there's a big relationship between aluminum and memory loss.
Because my mother cooked in aluminum when we were growing up.
Yeah, lead, mercury, those are the heavy metals that are associated with memory loss.
But if we put some foil over something we put in the oven, don't worry about it. Aluminum
I think
foil.
that's okay. Yeah, just don't put plastic over things and cook with them. That would be worse.
Really? You are a fountain of information. Okay, another myth, you cannot improve memory loss. That's a myth?
It is. We've actually shown in our clinic that our average patient going through our program improves their memory by 25%, their brain function. So we actually now know that if you make the right choices, the right food, the right nutrients, the right activities, you can improve your brain.
That is good news. Also that Alzheimer's disease won't kill you.
Once you get advanced Alzheimer's, it's almost universally fatal. Unless you die of something else,
Yes.
it's terrible. I've seen it in my own family with my own, my stepfather Chuck, my mother-in-law Joy. I mean, both of them suffered from dementia. Joy had Alzheimer's. It was awful. I don't want anybody to have to go through that. And what was worse, it was harder on the family than it was them.
Yes.
So nobody wants to become a burden on their loved ones. And that's what happens with this disease. It's terrible.
What is the mechanism that finally takes their life? Is there a heart connection?
Well, eventually, you wouldn't eat unless someone fed you. You don't get up and walk. Your brain, not only do you not recognize your loved ones, not only are you incontinent and have to wear a diaper, but you're not moving. You're just sitting inert with no stimulation. And then eventually you'll get an infection or something will happen, but the real cause of it was the brain shrinkage.
This is the last myth. There are treatments for Alzheimer's. Is that a myth?
Well, there's no drugs. There's 200 FDA-approved medications for memory loss. Not a single one has been shown to slow the progression of the disease. And the latest one that was out, they had big hopes. They'd spent millions on it. They just pulled it from the market because it just wasn't working. So we have so even the hoped for in the future has been dropped. We don't have a single med that really stops the progression. But we can make that change with the 5 easy steps that are part of the Better Brain Solution.
And we're out of time, but the next time you're on, we're going to talk about the 5 easy steps. I thank you for being here today to educate my wonderful viewers. And you stay with me. Have a couple things to say before we have to say goodbye.